Support for Colorado Today comes from Safeway, where you can get a free honeysuckle white turkey when you spend $100 or more in a single transaction through November 27th. Clip the offer in the Safeway app and make your holiday feast delicious.
Support for Colorado Today comes from Credit Union of Colorado. With access to over 30,000 ATMs and a mobile app, they're dedicated to offering the services of a big bank with a heart. Learn more at honestlygood.org.
There's an update on the Tina Peters saga. You probably remember her. She's the former Mesa County clerk who's serving 9 years for crimes she committed around the 2020 election. President Donald Trump has demanded her release, and now federal officials have requested that she be moved out of state custody and into federal prison. Her supporters say that it would be a safer environment while she appeals her conviction. The state tells us they're reviewing the request. I'm Arlo Perez Esquivel. Coming up, balancing Colorado's yearly budget is getting harder to do. Is there anything lawmakers can do to escape the cycle?
I think we're all just feeling, it's even worse than we thought.
I know the feeling, Madam Chair, that it's even worse than I thought.
Then, some Coloradans losing health insurance coverage may decide to skip vaccines and screening tests. We'll tell you about an alternative.
We're actually going out to the community and meeting people where they are.
Plus, Denver's national women's soccer team hasn't started yet, but the team is already threatening to leave Denver and move to the suburbs.
But any other plan that the team chooses to pursue would have to move fast in order to keep with the team's timeline.
It's Tuesday, November 18th. Here's the news in Colorado today. Colorado is stuck in a cycle, one of state budget shortfalls.
I'm starting to get a little bit of a Groundhog Day feel because it seems like each year and each presentation I come in and there's a shortfall of about $1 billion to talk about.
$1 billion. That's state budget analyst Craig Harper a few days ago. Lawmakers managed to plug the hole this year, but in a new forecast, Harper and others say it's going to get harder and harder to do that each year that this goes on, since it'll be more difficult to figure out what to cut to stop the cycle. Jesse Paul of the Colorado Sun and the Capital News Alliance is here to explain what is on the chopping block. Jesse, what's the primary driver of this budget shortfall that we can now expect to continue each year?
Medicaid is really the factor here, and that problem's been compounding really since the Great Recession. COVID didn't help things. JBC staff director Craig Harper, he's a nonpartisan staffer at the Capitol, said Medicaid spending during the pandemic was, quote, explosive. It's been the fastest growing part of the state budget, growing by more than 40% since the 2018-2019 fiscal year. That's far more than inflation, and it's also far more than other major budget line items. A report from JBC staff showed that most other departments' spending in Colorado had largely kept pace with inflation, so that just shows how much of a pain point Medicaid has become on the budget. And lawmakers on the powerful Joint Budget Committee, well, they found this news to be pretty upsetting themselves. They knew it was bad, but I don't think they realized it was quite this bad. Here's Chair Emily Sirota, Democratic State Representative from Denver, responding to the staff director's presentation.
I think we're all just feeling, it's even worse than we thought. Please continue.
I know the feeling, Madam Chair, that was my week last week. It's even worse than I thought.
Okay, that doesn't sound good.
Well, it means that a lot of tough decisions are ahead for state budget writers.
As I mentioned, this year lawmakers made a bunch of small decisions to be able to plug the hole. Why can't they do that in the future?
Well, in order to address this year's budget deficit, which was $1 billion, lawmakers tapped into some pots of unspent money. And while that well hasn't completely dried up, it's dramatically been diminished by all those decisions that they made. So that means that in order to balance the budget in the future, lawmakers will have to look closer at reducing their biggest line items. Those are things like Medicaid, as we've mentioned, K-12 education, and higher education.
Governor Polis has zeroed in on Medicaid. What is he proposing?
Well, he still wants to increase Medicaid spending next fiscal year by about $300 million, but that's less than half of what it's projected to cost if the state were to keep its Medicaid offerings just as they are. The governor's really eyeing Medicaid because, as we mentioned, that's the real driver of the problems here. He thinks there are lots of areas where trims can be made to Medicaid without really hurting Medicaid recipients. And the bottom line is that Medicaid spending is outpacing everything else. So either you cut Medicaid or you have to cut everything else.
And what did lawmakers think of that?
They weren't too keen on the idea. Both Democrats and Republicans on the Joint Budget Committee were really critical of the governor's budget proposal. Again, remember, this is just a proposal. They'll ultimately decide where the money's spent. But what they said is they're concerned about the long-term implications of Medicaid cuts. And it's easy to understand. Taking away people's healthcare access is not popular. It's a really tough political decision to make. State Senator Barbara Kirkmeyer, a Brighton Republican who's running for governor next year, said the state was facing a, quote, crisis of priorities and that Medicaid was the wrong place to cut. She went so far as to call Polis's proposal appalling.
This isn't a trim. It's a blow to families who are already fighting just to get care. That's what's going on here. These numbers represent real people. These cuts are impacting real people in our state.
Now, Polis said in response that the money has to come from somewhere.
Basically, this trend will crowd out all other public spending that we do. No money for roads, no money for public safety, and that's why we simply do the math to extrapolate those trends. So we don't think that's the right direction for the state. We think highways and roads are important. We think public safety is important. We think agriculture is important, all the other great things that the state does.
So then what are lawmakers' ideas to tackle this budget shortfall then?
Republican members of the legislature really want to look for cuts on the bureaucratic side of things. So they want to shrink government. They argued that under Polis and the Democratic majority at the Capitol, that government has just gotten too big. But the head of the governor's Office of State Planning and Budgeting said that that would, quote, be a drop in the bucket. Like, you can do that once, but where do you cut next fiscal year when Medicaid keeps growing and you have less meat on the bone in terms of bureaucracy? So there's only so many cuts you can make there. And Medicaid is growing much faster than those cuts could basically allow. The other option besides cutting bureaucratic costs, of course, is raising revenues. So some Democrats think the legislature needs to find a way to raise more money. That would require changes to the Taxpayer Bill of Rights, but those changes require voter approval, and voters have been really reticent to tweak Tabor.
The one certainty that we do have is that lawmakers here have to pass a balanced budget. When will we know for sure if the legislature and Polis will take up the big questions of Medicaid or education funding, or try to go in one of these other directions?
Lawmakers are on a break until January. They'll all be back at the Capitol then and start really in earnest taking this on.
Jesse Paul of the Colorado Sun and the Colorado Capital News Alliance. Thank you so much.
Thank you.
You just heard that the governor and the state budgeters are considering whether to pull back Medicaid spending next year. That would be on top of federal cuts coming to the program. Already, 100,000 Coloradans could lose health insurance coverage in the next couple of months because it gets too expensive on the state marketplace. But a new alternative in Weld County may offer a glimpse into the future of at least basic preventative care.
Good morning. So we are here for the health department. So right now,
Laura Johnson is a community health worker with new wheels. She rides in a mobile health unit to rural and underserved neighborhoods in Weld County, along with a coworker, Shanti Sanchez.
It's just like public health at its finest, is where we're actually going out to the community and meeting people where they are to get them the services that they need. So I think
the mobile health unit gets most of its funding from state grants and health insurance reimbursements, and Weld County makes up the difference. It's on the road 3 to 4 days a week, offering free vaccinations and diabetes screenings. It stops at low-income housing parking lots, at food banks, and health fairs. At some events, they can provide up to 170 STI tests. Sanchez doubles as a nurse and a clinical outreach coordinator on the unit.
There's a lot of vaccine hesitancy. There's a lot of hesitancy with healthcare. There's a lot of hesitancy with government, and the mobile unit kind of encompasses all of those in one.
Part of the hesitancy stems from confusion and lack of familiarity. About 30% of Weld County's population is Hispanic, and nearly 1 in 10 people were born outside the U.S. Johnson and her coworkers speak English and Spanish. That's helped them deal with some of the language barriers facing patients.
Sugar about the 3 or 4 months. Estamos ofreciendo todos los servicios para la comunidad. Estamos hoy en la...
The program is 6 months old, and it's still figuring out how to expand the language services beyond Spanish. Patients can book an interpreter ahead of time, but walk-ins have to rely on a telephone translation line. Regardless, the mobile health unit is showing early signs of success. For patients like Tyler Wiedemann, who works at an apartment complex in Greeley, it's been a lifeline.
I'm pre-diabetic, so I thought I'd get my A1C checked also. I would rather not go to a hospital. I prefer to come here. I would rather do this than go wait in line for 3 hours and take, time off of work to get a shot. So it's easy. 10 minutes, ladies were really nice. It was real easy peasy, so I would rather do it this way.
More than half of the patients who receive care from the mobile unit sent a survey that they wouldn't have gotten it otherwise. And it's a huge upgrade from the pandemic days when Johnson had to stuff her personal car with medical supplies. Now, the mobile unit can go farther in more inclement weather and offer more services. 8,500. That is a number of people that have already reserved season tickets for the new professional women's soccer team, Denver Summit FC. But before they've even played a single game, the team is already threatening to build its future stadium outside of Denver. Denverite's Paulo Shalceda has been keeping up with the team. Paulo, the team's not actually threatening to leave the region entirely, but they are talking about leaving central Denver. So where was the stadium originally supposed to go?
Well, the site they've identified is in Denver's Baker neighborhood, near I-25 and Broadway. This plot of land has been vacant for decades, and city officials say the stadium could economically benefit the area, with more foot traffic and money to local businesses. The city's finance department argues it could generate over $500 million in tax revenue over the next 30 years, though some economists say those benefits are overstated. If the stadium moves from Denver, that hypothetical tax revenue also disappears. Another attractive thing about the site in the Baker neighborhood is that it's really accessible by public transportation. The team actually wanted that. The RTD stop that's nearby connects to 3 light rail lines, and there are several bus routes that stop there. If the team decides to move the stadium, it'll be harder for Denverites and residents in surrounding areas who rely on public transportation to travel to games.
So why is the team threatening to potentially find a different stadium site?
It's tough to know how seriously to take the threat and how much of it could be gamesmanship, but the team's ownership is upset. They say they need to get started building so they can meet a deadline to open the stadium by 2028, as they've promised the league. That would likely incur penalties from the league if they miss that deadline, but we don't know for sure what those could look like. And Summit FC says Denver City Council is taking too long to vote on the measures that would release the city funds needed to start the stadium's construction process. So the team sent a public message over the weekend saying they're considering alternative stadium sites outside Denver. The team has not officially pulled out of the plan yet, so it's just a warning as of now.
Wait, am I missing something? Is there a delay at City Council?
Yeah, so City Council has delayed a vote on some of the key measures by about a month. Members say the documents put in front of them by Mayor Mike Johnston's office are missing key financial details. Council members want to see a specific breakdown of exactly how $50 million in public funds will be used in terms of buying the land and building improvements on top of it. Council President Amanda Sandoval said she's paying particular attention because of an earlier land deal where the city, under Mayor Johnston, granted a developer more land than was initially disclosed. That had to do with Park Hill Park. Councilmember Sarah Parody also said she was frustrated by the city's rushing to accommodate the team's deadline, given the amount of public funds that are in question.
If the team were to move outside of central Denver, where could it go?
Well, they haven't said yet, but I'll let you know when and if they do. But any other plan that the team chooses to pursue would have to move fast in order to keep with the team's timeline. And there are, of course, questions of whether a different city, whether it's Aurora or Lone Tree or Centennial or wherever, could match Denver's financial commitment to the stadium's construction, especially on a short timeline.
Paulo, thank you so much. Additional reporting for today's show came from Juanita Hurtado Huérfano. Thank you for listening to today's episode. If you value this kind of hyperlocal journalism, support it by sharing it with a friend. I'm Arlo Pérez Esquivel. This is CPR News.
Support for Colorado Today comes from Credit Union of Colorado. With access to over 30,000 ATMs and a mobile app, they're dedicated to offering the services of a big bank with a heart. Learn more at honestlygood.org.
Support for Colorado Today comes from Safeway, where you can get a free honeysuckle white turkey when you spend $100 or more in a single transaction through November 27th. Clip the offer in the Safeway app and make your holiday feast delicious.